Welcome to Functional Roots, where whole body wellness begins in the mouth. I'm Amanda.
And I'm Heather, and we're hygienists with a passion for all things holistic, functional, and naturopathic.
This isn't your average dental podcast. Around here, we dig deep, past the plaque, and into the powerful connections between oral health, the body, and the way we live.
So, whether you're a fellow dental professional, a wellness enthusiast, or just someone curious about taking a more natural approach to your health, you're in the right place.
So grab your favorite herbal tea, settle in, and let's get to the root of it all.
Awesome, and welcome to today's topic. We're doing Nutritional Counseling 101 with hygiene mom, Stacy Weisman. Welcome,
So,
Stacy.
Stacy,
Hello, everybody.
we are excited to have you.
Yes.
I am so excited to be here.
So, Stacy, you are a registered dental hygienist, oral myofunctional therapist, passionate advocate for whole body wellness through functional oral health with over 2 decades of clinical and academic experience. You hold a Bachelor of Science in Public Health and a Master's of Science in Biomedical Science, and you continue to bridge the gap between traditional dental care and integrative health. As the visionary behind the Hygienist Mom on social media, you empower individuals and families with the tools, education, and support needed to optimize oral and overall health. Through your work in salivary testing, mineral and food sensitivity assessments, nutritional counseling, and myofunctional therapy, Stacy, you are redefining what it means to care for the mouth as a gateway to the body. So on this podcast, we are excited to get to dive deep into the connections between oral health, nutrition, and systemic wellness. So welcome. Thank you.
That was great.
I'm so excited for this conversation because these are all the things that I preach
Yes.
as
Yeah.
well. So,
And as we should, because for so long we've had the mouth detached from the rest of our body, and we really need to get back into it. And I'll get into it as well. But a lot of hygienists are like, I'm not just a teeth cleaner. I'm not a teeth cleaner, but you're billing for a pro fee. So you're just a tooth cleaner. So why are we not? Again, we'll go into billable codes and what that means, because it's actually patient care. We need to be charting what we're actually doing for these patients to give them the best care that they need.
which is so cool because I literally just sent a whole bunch of the codes that we're going to be talking about today to an office who is doing salivary testing, and they were questioning why they would charge for OHI or nutritional counseling. So this is going to be amazing. Looking
Perfect.
forward to it.
Yes. All right, Heather, take
All
the floor.
right. You've been such a unique you've had such a unique shift in the clinical hygiene into functional nutritional coaching. So what was the moment that actually sparked you to pivot?
So the first moment was really myself, right? So I was really into health and fitness at the time. I had went from being a vegetarian and vegan to then starting to eat more meat, right? I was competing, doing more endurance stuff, and my body just was not healing with eating a more plant-based diet. So I was like, I really need to dig deeper into this and see why my body is not healing without I'm doing everything right. My body weight is where it should be, but I'm not recovering from my workouts. So it started there. And then as I started then bringing it into clinical dental hygiene, was like, oh, my patients that are coming in where their gums are bleeding, I would see them every 3 months, put them on perio maintenance, and still gums were bleeding all the time, putting them on every different type of protocol that I was aware of at the time. This is almost 20 years ago, early on in my practice. But once I started really looking at their diet, looking how often they were eating, look at what they were eating and consuming, it was a game change for all of my patients. And a lot of it, I at the time was doing a lot of Mediterranean based diets, lots of fish, lots of healthy fats, beans and nuts, things like that. But now, again, that I'm more aware of this thing, there's so much more that we can do for our patients and just meet them where they need to be with their diet and nutrition. So the pivot for me were just those chronic gingivitis patients where they were young. I wanted to stop the bleeding from progressing into any type of bone loss or degenerative issue that I could then not repair in the future. And once I started bringing nutrition into their practice, that was the biggest thing. Going more into the functional side of it, more recently, I want to say about 4 or 5 years ago, I had a patient who was very neurodivergent, was a brother, had 3 other siblings. Same thing, they were all had sensory issues. And the mother had brought up that they had the MTHFR gene mutation. So I knew a little bit about it, but then I started really researching it as they were bringing these questions to me. Because the mom is, I don't want fluoride. And I'm like, okay, but then the kid had a dairy issue. So I'm like, what else is there to remineralize teeth? And that's what drew me then into hydroxyapatite and pH balancing and all those kinds of things to help this one particular family. And just getting into what they needed helped me too. It helped me help other patients that are looking for more alternative options to conventional dentistry. So that's really what had my shift go more towards the functional side, was to really help those families that are doing the research and trying to help their kids, because they see how their kids struggle each and every day, and they want to try to help their kids in every way they can. And if it means not using a fluoridated toothpaste, then it means not using a fluoridated toothpaste.
Yes. I think the most powerful statement, there was a lot of really great little nuggets in there, but meeting the patients where they're at, because I think addressing nutrition is absolutely critical. But when you have a mom that's frazzled, overwhelmed, last thing she's going to want to talk about is food, more than likely. So
Right.
just being able to empower those patients or give them those things that, like, this is still going to help. This is going to move that needle towards what our goal is for you. So I love comprehensive providers taking into account everything and not just what the traditional protocol has been for the past 60, 80 years in dentistry.
Brush your teeth, floss, and use
Brush and floss. Yeah.
Yeah.
I think that's super fascinating because, too, with the bristle test, some of the practitioners come in, they're like, they have a low decay risk. And going back into that diet and the more vegetarian diet, sometimes they'll be like, I don't understand. We don't have an airway issue and we don't have a dietary issue. But when I dive in, they're on a more vegan-based diet. And I'm like, what about the fatty vitamins?
Yeah.
We might be missing some key nutrients in there. That's the driver for the disease that you're seeing. So it's just the bacterial dysbiosis. And we do need to pay attention to the nutrients that we're putting in there and whether that's actually the driving factor. So
making sure our body's using them correctly too, right?
Yes.
We be getting all the nutrients that we need, but our gut dysbiosis might be so overwhelmed and we can't absorb everything that we want.
Exactly.
So one of my favorite patients from a myofunctional therapy standpoint that I work with, and again, when I look at a patient, I'm doing myo, I'm doing nutrition, I'm doing all of these things to help comprehensively bring them together. And this is actually the idea of the cohort of where I did my myofunctional therapy program. She said, Stacy, you have such a passion for nutrition. If you can bring myofunctional therapy and nutrition together, you will stand out from so many other people, because that's really where you need to start with. You need to start with their overall health. And myo is going to help with that, but nutrition's a big part that a lot of myofunctional therapists don't have as well. But particularly one of my patients, she's a 12-year-old girl, was having severe TMJ pain, saw 15 different providers, 15. And this is before I had even saw her. So she goes to our church and she was helping out. I teach at her church and she was helping out with my little kids class. And I said, what's your diet like? She said, oh, she has so many food allergies. And I said, okay, tell me more about that. She has meat allergies. So she's been vegan since she was 4 months old. This girl has never eaten meat because she has such a severe meat allergy. So when she was and I said, okay, do you supplement with any like B vitamins, B12s or B6? Because she's obviously not getting it through her diet. And she said, no one's ever mentioned that to me. Within 2 weeks of me getting her on a B vitamin, like a complex B vitamin supplement, her lockjaw went away. She went to 15 different providers and no one ever connected the dots. And this was just in a simple conversation that her mother was bringing up to me. Oh, you're a dental hygienist. Oh, you're a myofunctional therapist. What can I do to help my daughter? So yeah, it's really interesting how nutrition can really be connected to everything.
And it's just not vitamins either.
Right.
I had a patient with severe chapped lips, like beyond what you would ever think of chapped lips for
Yeah.
months. And same thing, she went to several people to try to figure out the base of the reason why. And I said, you need to get tested for mineral issues. Like, I think you have a mineral deficiency. It took her 3 practitioners to find someone to do a mineral test on her, and problem solved.
Yeah.
So
Yeah.
it's so much more beyond the bacteria in the mouth when we
Oh,
have
absolutely.
things
Yeah.
showing up. So that's amazing.
And that's the power of the hygiene provider opportunity, because we have more time with our patients than really any other health practitioner in any aspect of health. I think
Oh,
maybe
yeah.
only a massage therapist might have us beat, but we get an hour with a patient, and that's an opportunity to dig into these conversations and get to that root cause, not just the nice band-aid approach and the fixing of the problems, but really getting to those.
Yeah.
I love
do
that.
have a little bit of a follow-up. Stacy, I never learned about MTFHR until I went into a biologic practice. So can you just give a real base information on what MTFHR is in very basic terms, so that anyone who's listening who isn't in the functional side of things and has never heard of it, they understand what you're talking about there?
Sure. Yeah. MFT or MTHFR, it's a mutation gene. Okay. And about 50% of the population have it. So it's a lot of people. And what happens is that people cannot metabolize folic acid. Folic acid, it's in everything. It's in cereals that our kids are fortified with. However, if a child has this genetic mutation, they're going to be holding on to this folic acid, and they're not going to be able to detox it out of their body. So it's going to help it's going to cause an issue by clogging their detox pathways. And it's going to then it's going to accumulate more not pathogens, but like metals or minerals in our
Toxins.
body that we don't want in there or we don't want to use. So it's important to have your provider. It's literally like a swab that you can do this sample of to see if you're a carrier of this gene. I just did it for my 4-year-old. I had brought it up to my physician. He has some issues, not neurological issues, but like he has a congenital heart murmur. No one else in our family has a congenital heart murmur. He was diagnosed at 4 months where he had like a depression on his belly, and they're like, oh, that's a third nipple. I'm like, okay, weird. No one in our family has that either. When he was 9 months old, he had to get a x-ray done because they were worried that his frontal plates were fusing too quickly together because he had a cone-shaped head, and it ended up they weren't. Everything was fine. But like all those things led up. I'm like, something is just not adding up. What's going on here? With Rupa Health, I do my Bristol testing through Rupa Health, and they're so amazing. And so I was like, you know what? I'm going to order a test for him and do it through their physician services and see what comes out. And sure enough, he had it. So at least now I know that I have to give him a methylated B vitamin, and I'm not going to give him folic acid fortified products. So he can help detox his pathways, not hold on to
Awesome.
those
Thanks
metals.
for recapping that.
Yeah. Yep.
Amazing.
Stacy, this is a good segue. So there's a lot of hygienists that feel stuck in their traditional roles, and we talk about burnout a lot in hygiene. Just having this conversation is probably going to sound like something wildly different than the traditional hygiene role. What would you say to someone who's curious about stepping into a more holistic or functional model, but just has no idea where to take that step?
And honestly, the hardest step is that as hygienists, like we get into what we do because we love what we do. We love helping people. We love teeth, right? We love oral health. We love the conversations we have with our patients. But we do have this load over top of us that it's overwhelming, right? Where there's a lot of tasks that we're asked to do. And what I find is that a lot of people, they're like, nutritional counseling, that's one more thing I need to add to my plate. But You're literally just talking to your patients. And one of the things that I love about nutritional counseling is it's something I can bring to me, whether I'm temping, whether I'm starting at a new practice, wherever I'm going, I can bring this with me because it's not a microscope I have to bring. It's not a ultrasonic scaler that I have to bring, but having that education in nutrition, I can open that conversation up with any patient anywhere that I go. So for the hygienist that's burnt out, what I usually tell them is I'm like, find out what you're passionate about. Find out what you really love about dentistry and focus on that. And it might be leaving a toxic workplace. It might be cutting your hours. It might be doing whatever it is. But at the end of the day, it's going to give you more gratification and it's going to help you become a better provider. Don't give up on it. And there's so many options out there. Like I never in my life thought that I would ever leave clinical hygiene. And even though I'm still in clinical hygiene, I do it a couple of days a week. Like I never thought I would be doing something more remote or working with Rise or working with other brand companies to really enhance my career and make me a better clinician. But it's really just stepping outside of the box. And one of the things I wanted to bring up too is that as a hygienist, like we go through school and it's you have to get your license, you need to be certified, you need to do this and that, and you can only do so many things. But there are so many other health and wellness functionalities that we can bring to the practice where you don't necessarily have to be certified, right? So like even as a myofunctional therapist, yes, I cannot practice as a myofunctional therapist and a dental hygienist, but then that's why I created my business because I want to be able to help people outside of the chair too, or for those times where I don't have enough time to talk to them in the chair, I'm like, hey, we have telehealth now. Meet me on Zoom and I can go over more of these things in depth with you. So there's so many ways that we can help our patients without feeling like we're burning out. It's just finding other resources and able to help them and to help yourself find out where you want to be as a provider.
And just getting that fulfillment.
Yes.
Like, I think there's so many things that are very gratifying on the hygiene, traditional hygiene, right? We get that we have our schedule, that's our checklist. But I think there's so many other opportunities within the day to have that, like, I helped this patient beyond cleaning their teeth today. And I would imagine like having the opportunity, like you and Heather, having those businesses growing and helping those patients outside of traditional clinic, because you're making lifestyle changes for these patients. And that is providing education and empowering those people. And that is our goal as hygienists, is to create and empower a patient that doesn't need us, that is not reliant on us, but they have the tools necessary to make better choices or to find those resources. I think that's the exciting thing about the functional side of things versus traditional healthcare, where it's you're going to be reliant on us for X, Y, and Z, but really having a little bit more empowerment on the patient side of things.
Yeah, absolutely.
And I love that you're marrying all three of the things that I talk about with the airway, nutrition, and I always teach that there's a triangle there. We're not going to get our patients better unless we deal with airway, guts, and the mouth. And it's all three, and you're capturing all of that.
Absolutely. But that's the thing is so many patients want it, right? I can't tell you how many times I'll help out a friend. They're sick. Oh, can you temp in my office for a day? And I just start talking with some of their patients. And then next thing I know, they're like, Stacy, my patients, they ask me for your phone number. They want to connect with you. And I'm like, I know, because so many people are so tired of not getting the help that they want or need. And so where Bristol came in personally, so my sister had been having heartburn ever since she had her last son. So he's 3. So for about 3 years, she's been dealing with heartburn. And had scopes done, colonoscopies done, nothing. No one could find anything on the blood work, on the scans, nothing. I said, Jess, let's do a salivary test for you. Let's see what pathogens come up. Sure enough, she had some fusobacterium in there and some other like nasty pathogens that I was like, these are probably causing your heartburn. And I looked at the strains and I'm like, all right, let me get you on these probiotics. And again, within a couple of days, her heartburn went away, and knock on wood, it's been away for 8 months now, and she hasn't had an issue. But right, it's like those things that there's these patients, and we're going over medical history, right? So it's easy to get this out of patients to be like, hey, I see this on your medical history. Let's look into this. I might be able to help you and figure out what these problems are coming from.
Yes,
Yeah.
absolutely. And I read a really cool research article a couple weeks ago on acid reflux and the
Mhm.
biome. Look for treponema species too.
Yep. Yep.
The research article I found was, and I can see it now, definitely like higher numbers of those treponema species in the raw results. Look for those because those
Okay.
are considered a biomarker
Or acid
acid
reflux.
reflux.
Right.
So,
Isn't that
yeah,
crazy?
super fun.
Yeah.
But yeah, and they like a more acidic environment. And as we bring the acid up, then we have inflammation and loss
Mhm.
of tooth structure and all of that. Yeah, super cool. I'm glad you figured that out for your sister.
It's interesting too, because you're talking like we're talking the functional health and wellness space here, and unlicensed, I don't say providers, because that's not necessarily true, but practitioners. I've seen a lot of articles talking about the projected growth of the industry. It's supposed to be like a $6 trillion industry by 2026. So
Wow.
like
I
next
think,
year.
yeah.
Because for that very thing that you're talking about, people are just done with tradition.
Traditional.
It's okay, I have insurance, but we all know they're not covering very much. So if I just pay out of pocket for this, I'm going to see more results than if I go the traditional route and get sent the full ringer of seeing my primary care and then getting a referral and waiting 8 months to get in with a specialist.
Mhm.
Just that whole thing. It's just such
Right.
a, what is the term? Rigmarole?
Yeah.
I don't know. Just such a direct, like cutting the fat essentially of the system. It's
Yeah.
not cheap, but it's the better way to go when you want results.
Right. And when it comes to a point for a patient too, where they're just like, I need help and I don't care how much. And I mean, my mom just spent $10,000 working with a functional medicine provider because she was having all these side effects from her breast cancer treatment, anti-estrogen pills. And I'm like, Mom, you don't have to take them. Find out where your hormones are at. Go work with a functional medicine provider and they can help you better than what these people can.
Yeah.
So, yeah.
I've
So,
done a program, not quite 10,000, but
yeah.
not far from, and best money I ever spent. No regrets.
Because you got answers that you probably weren't going to be getting.
And education and
Mhm.
empowerment and just starting to like really look at things very differently. And it led my husband. He had a very serious issue happen over Christmas this year. He thought he was dying, didn't
God.
tell
Yeah.
me. Yes, got all his affairs in order. I'm like, are you kidding? Turns out hiatal hernia and he has PVC, so premature ventricular contractions.
Yeah.
Went to the cardiologist. I went with him. He did let me go. And the doctor was like, oh, this is normal. And I don't feel normal. I thought I was dying. And so he found a functional medicine provider in Florida that was specialized in this. He's lost over 100 pounds this year.
Wow. Good for him.
Yeah.
Yeah.
But practically symptom free. And traditional route would have been, oh, you're fine, antacids, really no diet change.
Medication.
Maybe medication and then have surgery, which doesn't
Mhm.
really fix hiatal hernias.
Exactly.
So
Yeah.
Yeah.
I know. I had a patient, right? This is like such a sad story. I was just in France and I'm like, oh my gosh, tell me more about it. She's right before I left for France, I was in the ER. I'm like, oh my gosh, for what? I thought I was having a heart attack, but I just had really bad acid reflux. And the doctor told me I just can't drink red wine anymore. And I said, yeah. So I spent my whole vacation I forget where exactly she was in France, but like in this very wine country of France. Yeah, I could not drink any red wine in my favorite type of red wine in France when I was there for 10 days because I was so worried about my acid reflux coming back and that I would have to go to the ER because I felt like I was having a heart attack. Again, I'm like, let's salivary test you. Let's see where your pathogens are. Like, let's get to the root cause of this. But
yeah,
I was like so sad for her. Wow, you had not
Missed out.
vacation because of your acid reflux.
And the answer in traditional medicine is let's put you on a proton pump inhibitor and then reduce the acid level in your stomach that then leads to gut dysbiosis problems.
Right.
Oh,
And then you're not
medicine
going to be able to
deficiency.
absorb calcium and then you're going to have osteopenia and then
Yes. And most people are put on that for such a long term. I have that conversation all the time. I'm like,
Oh, yeah.
you have to go see a functional medicine doctor, and
Yeah.
you should not be on these for long term. It's
Right.
not the answer. It
No,
causes more
it's crazy. And then they also, the mom part of the hygienist mom.
Yep.
Very candid. That
Yeah.
felt planned, actually.
No, he's my little one's my sweet one. He's always telling me how much he loves me. But yeah, I know. And right, the scary thing is that people can get these over the counter and they
Pop them like candy.
pop them like candy and eat them like candy, and they're causing all these issues. Yeah.
So tell me a little bit more about, I know we touched a little bit on your billing for insurance.
Oh,
So
sure.
let's talk a little bit about the insurance coding, because I know this is a hot topic. I teach about how to code out for salivary testing, and then some offices who are still within network, they need to find some ways to be able to gain their income from the time spent going over the test, doing that nutritional counseling. So let's dive into some of that coding. And then I would love to hear how you're utilizing the coding outside and that perspective and how you've integrated it into your coaching.
So I don't code. Coaching is just flat fee. I
Okay,
don't do any insurance billing or coaching. And honestly, the only reason I don't do that is just because the way my business is set up. My business is set up as an LLC. So theoretically, like I can be a wellness coach, but I can't be like a provider as an LLC. So that's simply why there. However, I'm in California. So my plan is to eventually get my RDHAP, open my own brick and mortar practice, and then be able to integrate that into there. But for how I coach, right? So like I put a guide together for people because there is so much confusion. And a lot of people think, okay, if I just tell them they'll not eat sugar, that's nutritional counseling. But it's so much more than that. And we can offer so much more to our patients. So do I feel comfortable with coding the 1310 for that? No, absolutely not. But if I'm going to sit down and talk to the patients about really let me get you a 3-day food diary, or let me review your 3-day food diary. Let's go over your nutrition. Let's see where we can help you here and do this. Then yes, I would be wanting to bill out for those codes. One thing, at least for the nutritional counseling for the prevention of dental disease code, is that you want to be able to also have your caries risk assessment, right? And notice how I said nutritional counseling for the prevention of dental diseases, right? Gingivitis, periodontal disease, caries, right? So literally everybody that you see in your practice could theoretically benefit from nutritional counseling, right? Because someone in your chair could probably have one of those issues, or they could at least be at high risk or moderate risk for one of those issues. So one of the things that I like to do is provide, and the ADA has documentations on how to do caries risk assessment scores and periodontal risk assessment scores. So I still have that on hand. Make sure that you're charting that for your patients, because insurance is going to want to see that to be able to have that code to be able to be reimbursable for it. And I always say that lightly too, because you can treatment plan as much as you want. You can pre-D as much as you want. It does not mean that insurances are going to cover it, right? That's like a whole other story. Not going to be out to best treat us, but we should still be providing what we are doing for these patients, because if we don't utilize these codes, guess what? They're going to go away, and they're going to go bye-byes if you're not utilizing these codes. I always like to integrate the salivary testing, or recommend that at least the salivary testing is being done when you're doing nutritional counseling, because again, it goes hand in hand. So certain pathogens, like certain environments, certain foods are going to give off those certain environments. It's going to help you guide your patients for a better dietary outcome when it comes to oral health or even gut health. So I'm sure you're more well aware, Heather, is how the foods have to do with in our mouth and our gut. It's all so connected. And once people realize that, they're like, wow, this is great. But yeah, but going back to the billable codes, I usually tell patients that don't be afraid to use teledentistry. It's out there for us to use. And it was huge during COVID. I will say some insurance companies are getting a little more pickier about it, like where you are location wise. You have to be within a certain state where your patients have to be. But it's there for us to use and utilize to give more access to care for people that need it. I'm sure some of you have seen, you have patients, like when I was in Philadelphia, I worked in Philadelphia for 15 years. I would have patients fly from California to the cosmetic dentist that I had worked for in Philly. How am I going to be able to communicate with them? Guess what? We're doing televisits with them. So it's easy enough just to do it for nutritional counseling as well. Follow up with your patients, just like you would a dietitian or nutritionist or whoever you are working with.
And it couples really nicely with coding for salivary testing and the follow-up. So if you did the follow-up with that, you can do the nutritional counseling
With it.
alongside
Exactly.
it, because you can't look at the oral microbiome without having a conversation on what are you eating and what are your habits. I
Mhm.
ask all the time. I had someone the other day. It's interesting when people are saying, I don't eat a lot of sugar. And I'm like, okay, tell me what your general eating habits are. Like, walk me
Right.
through what you eat for breakfast, lunch, and dinner. It's, oh, I eat muffins in the morning, and then I might have pizza at lunch, and then I have rice and broccoli and maybe some meat. And I'm like, okay, that's all sugar.
Yeah. Right. That's all
It might not be
carbohydrates.
candy, but
Right.
it's all carbs that are feeding these
Yeah.
pathogens. We need to get more fiber and more meats in there so that we're feeding the good bacteria and making sure that we're well rounded. So I think we definitely can utilize the coding a little bit better.
And what I usually tell my patients too is I know some primary care providers, they'll say, hey, I want your blood work done before you come in for your annual physical. So they're ordering that blood work before they even come in, right? So they can review over a share side. Or if they don't, they're setting up a television appointment with you afterwards. So I tell my patients, I'm like, it's the same thing. I'm just testing your saliva instead of your blood. But hey, if you want to do HTMA or some kind of other mineral test, like you can do that too.
Love that. Stacy, have you ever read the Dental Diet book by
Yes.
Stephen Lin?
Yeah.
I just started it.
Okay.
So good.
Yeah.
So good. I feel like it should be required reading for dental
Absolutely.
school,
Yeah.
but dental hygiene school.
Yeah.
And
And
for
if you haven't read it, it's a must read as a
Yes.
hygienist. Yeah.
And it's a
I-
good read
I
too.
have
It's
those-
not boring. It is not boring.
No, and get the hard copies because there's recipes in there. I made the mistake of getting the
Back.
audio one, and I was of the digital version. I was like, darn it. But the Dental Diet and then Nourishing Traditions by Sally Fallon are two books that I put right in my care plans at times when especially for the patients who I do suspect that, have some major issues with their dietary component.
Yeah.
It's tying into the inflammation and into decay issues.
One of my life goals is to write a cookbook based on the dental diet. So I'm putting it out there.
There you
now.
go. If you need a recipe creator, that's what I do on the side too. Yeah, I work for it's
Fun.
called the Wellness Vault. My best friend owns it, and so I do like recipe creations for her. But we haven't done an
Fun.
oral health one, but we do.
There
like
needs to be.
menopause. Yeah, I know, right? And I told her I was like, I will be on it. She's like, I want to know more about the vagus nerve. And I'm like, I can put a guide together for you on that too. But yeah. So anyway, so I put like some content together for her recipe wise.
So in the aspect when you are clinical though,
yes.
how do you communicate the value of nutritional counseling to both patients and providers who still just are stuck in the old mindset? Dentistry is only what happens here and not whole body. So how do you phrase that or work that idea for those people?
So recently I've worked with really awesome providers and they're like, I learned so much from you when you're talking to the patients. And it's so heartwarming to hear that because I'm like, okay, I'm not a quack, right? Like I do know what I'm talking about, and I am trying to help your patients. And she did in our like Christmas letter, I really appreciate like how much effort and thought and education you give to our patients. And they love seeing you. They love coming in and they're just so much more aware of their overall health and how it affects their mouth. Right. So in turn, it helps her do the dentist that I work for. It helps her do her job a little bit easier too, right? Because these patients are coming in and trying to make them change. And so one person in particular, they had so much like thick, sticky biofilm. And then we got to talk. He said, "Oh, my son wants to put me on a pescatarian diet." I'm like, "Do it. Just do it. And let's see. Like, I'm going to disclose you now. Look at all this stuff on your teeth. Let's see. Don't make any oral health changes. Let's just see what your diet does." 3 months, he did not have any blue, because I used the two-tone disclosant. He didn't have any blue biofilm anywhere. He had a couple little spots of pink, and that was it. And I was like, dude, look at your tissue health. Look at your gum health. Look how much little biofilm you have. So that's one of the biggest things that I started integrating too was disclose. And I've always disclosed, but I'm usually the only hygienist that discloses my patients. But a lot of the providers that I work with, they're like, I need to start using this now. This is really helpful to have the patients see where all this stuff is going and what it's doing. But yeah, but the providers that I've worked with and the other hygienists that I work with, and then I'll hear them talking to their patients about like vitamin D and K2 and how we needed to absorb the calcium. And cod liver oil is one of my favorite supplements to recommend for oral health to patients. So no, it's been really welcoming, some of the information that I've been giving the patients and what other providers have been overhearing. But for someone who might be in an office where they don't welcome it as much, you let the patients talk for you. So I don't think it would be as welcoming to the practice if the patients weren't so excited about what I have to tell them. Right. So the patients aren't like, oh, what does she think she's doing? Like, why is she recommending all this stuff for me? The patients are excited to hear this information. They're excited to make these changes. They're excited that someone is finally listening to them. And the practice owners are like, wow, like the people want to come in, they want to see her, they want to talk to her more, they want to pick her brain more. So it's a better production model for them.
Those are huge points.
Yeah.
Have you tried Triplaque?
Triplaque? No, tell me
Oh
more.
my
Okay.
gosh.
Yeah.
Okay, look up Triplaque.
Okay.
For disclosing solution. It is
Okay.
the bomb. It's a gel that you
Okay.
put on. It's a little bit thick, so I used to water it down a little bit, but it'll
Okay.
show 3 things. So
It
early
shows the
plaque,
acid too.
yes, and
Yes.
it'll be
Okay.
bright blue with yes. It's
Yeah.
my favorite.
Yeah.
Oh, interesting. I have never heard of Triflac.
Yeah, I think I saw it. I didn't know what the name of it was, but yeah, I knew there was one that showed like the acid level too. Like
Yeah.
it showed the pH, right? Yeah.
If it's below 4.5 on the pH, it'll show up bright
Yeah.
Really?
blue. And I've actually put it in patients before, and their whole saliva lit up. And I was like,
my gosh.
"Whoa, the whole mouth is acidic. It's not just
Whoa.
black, but the saliva is like glowing blue." It's
Yeah.
yeah. So
Interesting.
definitely, if you love disclosing, I highly recommend getting
Yeah.
yourself
All
that.
right, I'm gonna have to get some of that. Yeah.
Are you using EMS or just traditional ultrasonics?
Just traditional. I have a piezo and
Okay.
polishing. No, EMS are, I would love to have one. They're just very expensive.
Yeah.
And my provider I work for, again, I'm only there 1.5 days a week. So they're not gonna, she's not gonna buy me one. But yeah, there's biofilm therapy can go beyond an EMS. And right, again, that's like where a lot of hygienists think, oh, I'm not getting this. They're not going to buy this for me. But hey, there are still ways that we can do this,
Yeah.
even if we don't have the state of the art equipment that our providers do or want to
Agreed.
pay for us. Yeah.
Agreed. Yeah.
Yeah.
There's still such benefit to just disclosing, right? Because it's
Yeah.
that patient education, that awareness, and then you're tracking it. Like you
Right.
said with that patient, like you showed him what his diet was doing to that biofilm versus after he made those changes, not changing any oral health, but just
Mhm.
changing that diet, what that's going to do. So that's
Right.
a huge testament to the patient right there.
Exactly.
So we saw your little one kind of in the picture. You talked a little bit about some of the health issues in the MTFHR with your son, raising awareness on the oral systemic connection through the lens of motherhood.
Sure.
What's your perspective on how motherhood has changed your process as a biologic hygienist?
It's changed a lot. Like I'm totally a crunchy mom now, right? Again, never thought like I would think like this, be like this, but again, like the more
None of us
you
did.
know,
None of
Yeah.
us did. We didn't see this.
the more you know. But yeah, honestly, gosh, so going back to what I did. So again, I'm from Pennsylvania, live in California now. In Pennsylvania, we have what's called a public health dental hygiene provider. So I was a public health dental hygienist in Pennsylvania, but worked mostly clinical practice. I was also a certified school dental hygienist. So I was contracted through a few different school districts. So this was before I had kids. I was working with kids a lot, going in, doing screenings, doing education. And once I had kids, my education for oral health switched strictly to just nutrition. And now airway health, right, Heather? Because like I just did screenings less than a year ago at a school. 80% of those kids I saw had grade 4 tonsil enlargement.
Yeah.
These kids cannot breathe. Their tonsils and adenoids are so enlarged, they have to breathe through their mouth because everything is so blocked and congested. So, anyways, that's my tangent on that. So, myofunctional therapy, I don't think I would have researched that unless I became a mom, because I remember 12 years ago reading an RDHA or RDH magazine article about it. And I'm like, wow, that would be really cool. But what do you do? How do you get certified? How do you practice? How do you do this, that, and the other thing? And then once I saw my kids starting having issues, my kids' friends starting having issues, going into the schools, seeing all the things, was like, I need to do this. I need to help these kids. So I started putting PowerPoints together for the teachers, for them to be able to observe mouth breathing, how to help them, reminders for them to have their kids keep their mouth shut, doing referrals, nasal breathing, all the things like that. It switched one from focusing on how to brush your teeth, how frequently to brush your teeth, to what are we eating? Because guess what? That sugar, that dairy, that's all inflaming our adenoids in our tissue too. It's causing the cavities. It's causing all the issues. So more recently, I volunteer a lot in the schools because that's, again, public health is like my passion. So I go to friends that are teachers or my kids' schools, and like at Halloween, I always go in right before Halloween and we read labels. I say, okay, this is how much sugar a kid should have a day. This is how much added sugar a kid should have a day. This is what's in this piece of Halloween candy. This is what's in this piece of Halloween candy. Hold Starburst in your hand. Hold an M&M in your hand. Which one's going to melt? Okay, the one that melts is going to be a little bit better for your teeth than the sticky one. So I go in and I do a lot of like hands-on nutritional education for the kids, and it's heartwarming to see them because they'll come in like after Halloween, they'll see me, Mrs. Weisman, I only had 2 pieces of the Hershey chocolate for after Halloween, and then I donated the rest. So we go over how like we can donate our candy, or the Switch Witch can come and pick up the candy, and you can, for my kids, they leave a gift card, and then we go to Target the next day and they can pick out a prize at Target versus eating all the Halloween candies. Yeah, so there's definitely alternatives. My poor kids, they don't quite get all the sugar that I had thought that they probably would, but it's not good for them. And aside from oral health, just their overall health. It's not.
I love that. I wish that the schools would teach more on the airway and nutrition side than the happy visit of trying to get the toothbrush in.
Yeah.
Because we're missing the boat on the education on that side. I didn't learn anything about airway until 5 years ago, in moving into the biologic side of things and understanding Mellon-Petty score. And I'm constantly teaching what's the Mellon-Petty score and doing those screenings and trying to get offices to understand that component of it. So I think that's amazing. And it's awesome that you're studying so young with your kids. I wish I had known all of this, as I'm on the other side where mine are getting married and graduating, and they're all airway. Like my oldest was like bedwetter till late. She has attention deficit, deviated septum. We had to pull 90% of her teeth because she was so crowded and no one expanded. Like all of the things that were screaming at me that I know now, I wish I had the hindsight. So I think it's awesome. Your kids are young enough where you can support that growing, and
they can benefit, and then
advocate,
and be like, yeah, my mom is crazy, the crazy dental lady, but
not crazy, not crazy.
The helpful dental lady. But no, my youngest sister, she's 7 years younger than me. She was getting ortho. I made her go get ortho when I was like my last year in hygiene school, because she had a 9mm overjet. 9mm. Never referred for like early intervention, anything like that. So she ended up having to have 3 different jaw surgeries to help fix everything. So ortho is definitely a passion of mine. It always has been. And then getting that education in airway health. I'm like, where was this the 20 years? Because again, like in Australia, they've been doing it forever. In Canada, it's part of the practice of dental hygiene. But in America, we're like, oh, the ENT, let's get more tubes in these kids' ears. Let's keep watching and waiting for the tonsils and adenoids to shrink. Yeah. So it's definitely this like epidemic that's out there that needs more awareness, and it's getting out there. But yeah, it's definitely something sad to see these kids struggle.
Mm-hmm.
So the switch witch, that is something new to me this year. I also
Sure.
don't have kids, so I'm behind the times, but I heard that and I was like, that is so clever.
Yeah.
So clever. But also like in the realm of schools, again, I don't have kids. I remember being in school. I don't remember there being any candy involved in school.
Oh, there
And
is.
now that's
So
how
much.
teachers are like getting the kids' attention or rewarding them is with candy. That hello, what the
Yeah.
heck?
Yeah. Right.
It's insane.
Yeah, it's almost my friend Valerie that works at the Wellness Vault, her and we met because our kids go to school together. So both of us are pretty passionate about sugar and education, and we're like, this doesn't need to really even start with the kids. This needs to start with administration. Why are they allowing this to happen in the school? So we have a fundraiser at our school each year, and each classroom is in charge of a game for this fair. And the kindergarten class, it was a cakewalk. And if I had no idea what a cakewalk was, I'm like, okay, whatever. They would set 10 pumpkins out, and it was like musical chairs around the pumpkin. Whose ever name or number gets pulled, that's number is on the pumpkin, gets a cake. Like not a cupcake, a full-size cake to take home with them. And I'm like, what is this teaching our kids? Like, yes, these baked goods are donated, but like, why can't they win a prize? Like, why can't we have these parents donate toys for the prizes? Why do they have to be candy or a whole cake, right? And that so they would win a cake. If your number didn't get pulled, then you could pick a candy out of the like candy bin. And this was not and this school goes up to high school, right? So this is like TK through 12th grade. They have booths like this. And this is how they're raising money for the school. And we're like, what are you trying to teach these kids? Like
And then on top of it, we have kids who are increasingly diabetic and overweight, and that's just feeding that a problem as well. At our school, I know I've gotten into a whole debate because our school gives our kids 20 minutes for lunch, 20 minutes to go down, go through the lunch line, eat the crappy meal that's provided, and then make their way out to recess in 20 minutes.
wow.
Which most of them, by the time they get through, they're shoving as much as they can in. They spend 5 minutes complete unmindful eating.
Yeah.
And then all throughout the day, their excuse was they can snack during. And I'm like, okay, and the snacks that they're getting are goldfish. Fantastic. I'm so glad
Great.
that we're teaching good eating habits throughout the school and contributing to disease, not just orally, but systemic diabetes and obesity and nutrition deficiency.
Yeah, no, it's going into the school and seeing what they're serving these kids is horrific. I'm glad my kids don't necessarily like the lunches that they provide, so they do, and they're young still. I pack them lunch, but yeah, and then just because I do go in, I volunteer a lot, so I'm usually out there when they're having snack and recess. But even just what the parents are sending them to, my kids would always be like, oh, so and so has gummy bears and Doritos and whatever. I'm like, yeah, but look at his teeth. Do you not see like all the carrot? Too, that's again that right. So going back to what brought motherhood into that, I remember the first day going into my son's TK classroom and going into volunteer, and 50% of the kids had stainless steel crowns on their teeth, on molars. And I'm like, we are not in a like perverse area, right? Like we're in a very well educated, affluent area in like this should not be happening. Like these the kids should not have this much dental decay. Like, what are we feeding these kids? And so then I started looking into their lunches. I'm like, what parent thinks that a TK should have Oreos at a 9 o'clock snack? Like, it just blew my mind. Yeah.
It's not to get political on this one, but I'm going to get a little bit political. The ADHA.
Yeah.
This is a fight that they're having of we need to have more fluoride education, more prevention on this. And it's like, if we cared about prevention, we need to be talking about nutrition, not fluoride. And for that matter, not even hydroxyapatite. It's nutrition.
Absolutely. It was sad for me because I've been an ADHA member my whole career. I was part of SATA. I was part of everything. I'm part of president-elect for Tri-County Dental Hygiene Society for CDHA. So I am very involved in the political side of it, but people don't realize we do not need systemic fluoride. Like, yes, topically, and that's a whole different conversation, but yeah, it will help topically, but we have other things that are going to help too that aren't going to cause as many issues. But yeah, I spend a lot of my days, I see so many patients with thyroid disorders, men, women, and I'm like, have you ever been told not to have fluoride? It's going to mess with your medications. And so I spend a lot of time educating patients on this. And this is where I see dilemma in the office because they're like, yeah, but they have caries. And I'm like, yeah, but I'm more worried about their overall health than them getting a cavity. They get a cavity, you can fix it. Their thyroid is going to be shot, and then their hormones are going to be shot, and then they're going to be fatigued their whole life and have all these other issues going on with them.
And thyroid function is wholeheartedly tied to metabolism and then leads to vitamin deficiencies and issues there. So it's compounding. And just for reference, because why is the thyroid so important? Because the fluoride sits in the thyroid and increases the risk of Hashimoto's, which is probably one of the #1 health issues that we see on our health histories.
Yep.
It is on the rise. Like you are definitely seeing it more and more.
Absolutely. Yep. For sure. And just another note, like the fluoride in the water isn't actually
organic.
No, it's a byproduct from the fertilizer company. It's not a medical grade fluoride like the stannous fluoride or what we're putting topically. It's not a medical grade anything. So it's not a fluoride deficiency that we have
exactly
that's causing it. Airway.
Yeah.
Like you said, these kids that can't breathe, they're dry because they're breathing through their mouth. And then it's diet. Those are the foundations of what we need to be preaching and not the fluoride systemic components.
But as long as big companies are funded by big pharma, we aren't going to see a change in that. But then there's people like us that can help educate our patients and make them aware and guide them in the right direction.
I say it frequently, but consumers are driving conversation. The more I saw you at CDA, and our booth was insane the entire time.
Yeah.
We were all just emotionally exhausted after CDA. But any of the shows that we've been to this year, even in Philly, we were there for the ortho show in Philly. So many patients were talking about my crunchy moms want healthier things.
Yeah.
And it's the moms, and we talk about the MAHA movement, but it's the moms driving the conversation, the consumer driving demand, and it's these moms. And it's the power of the moms. Are doing
I know. You can listen, you have a kid, like you can never stop. You know, the one daughter that was a vegan that I had shared earlier, her mother created a bakery because her kids couldn't have regular birthday cakes. So she has a vegan bakery for her kids. So it's just like, your kid has an issue, like you are going to find any way and anything that you can do to make your kid happy or to make your kid healthy or to make your kid just be the best that they can be. And it's a different generation now. We don't just take no for an answer, or we hear no, but we then question why. Why is your answer no? And you're going to tell me no, but I'm going to find someone that's going to tell me yes, and that is going to help me with something.
So on that thread though, So collaboration in the aspect that you're working in between like the dentist, the hygienist, and now the wellness coach, how does that look?
So I always tell my hygiene friends, like hygienists, we are wellness coaches. Like we are wellness coaches by trade. We've been giving oral hygiene instructions since school, right? And that's what we've focused on, right? Brush your teeth more. This is how you want to brush your teeth. This is how you want to do this. But looking at the patient holistically is really where you bring wellness into play. And again, it's person driven, it's patient driven. Patients want more of this. They want us to be able to help them any way we can. They don't want to be told that they have a cavity every visit. Or if they do, they want to find out what they can do to help. And they're tired of hearing about flossing more. They're tired of hearing about,
What?
yeah, they're tired of hearing about buy this product, get this product. Oh, you need this product, you need this. No, let's find out why. Let's get to the root cause of exactly why you're having these issues. Heather mentioned your salivary pH has such a big part of it. The Stevens curve. I mention circadian rhythm eating is one of the things, the easiest things that I tell people, like eat from 7 to 7, have 4 to 5 meals in that time, eat every 2.5 hours, and your pH should be okay. And your teeth will be able to remineralize and you should be fine. But what happens is that we so much focus on the problem and aren't trying to find the solution. We're trying our best to help get rid of it, but we're not actually getting it right. We're not actually getting to the root cause of our patients' problems. And it all has to do with one, how we were educated. Because I don't know about you, but like we didn't go over any dental coding in school.
Oh,
I had no idea what even like an SRP was until like after I had graduated, because we were just SRPing everybody. Like there was like everyone needed a great 4 hour cleaning and you maybe got their whole mouth done. It was so comprehensive. However, there was so much lost at that time because it wasn't applied to the real world. And once we're able to look at the patient holistically, that's when we're really going to start helping people. And that's really where you're going to start seeing the patients want to come to your practice too, because they don't want to have crowns. They don't want to have fillings. They don't want to have this. But they want someone to help them, guide them through why they're getting them.
yeah. School is not preparing you for the real world. School
Right.
is helping you get ready to pass boards,
Right.
and that is it. There are phenomenal educators out there that really do want to help help students get ready for practice. But at the end of the day, the school's success is defined by their graduation and their pass rates on boards.
Yeah.
That's the reality.
Yeah. And then there's the whole implementation of hygienists being trained on the job. I'm like, these offices that are going to be doing this are the ones that don't have the ones that like you've tempted and you're like, I need to leave. Like, I need to get
The ones that don't seal the sterilization bags, those offices, the ones that like, we just keep replacing it.
Yeah. Yep. You see their
Those are
gloves
the
going in
offices
the
that-
ultrasonic.
Yeah. They're not interested in this aspect. They're just pumping out patients.
Yeah.
Scale and go. They just think we're tooth scrapers.
Yeah.
So
But
they'll
yeah,
need a
but like I
divide.
said, like too, but bringing all of that to your patient is showing your worth, right? Like bringing all of this information to your patient from a whole wellness standpoint is making a hygienist more, showing them their worth, showing them how beneficial they are as a healthcare provider and not just a tooth cleaner.
Absolutely.
100%.
Yes.
100%. I think that's a slight point that we talked about last week, because that's when the whole Nevada thing was like really heating up. And I cannot control the ADA. I cannot control the House and the Senate of each state. And who knows how it's going to go in the future, right? But I know I can control who I am as a hygienist and how I act as a provider. And I am absolutely going to separate myself from the pack with how I treat patients and educate them. And I don't want to work at a practice that would ever accept that. I don't want to have to be dependent on that. I really think autonomy is the end goal.
Yeah.
Who the heck knows if that's going to happen for us? But that logically feels like the thing that has to happen in so many ways.
In
And
so many
it
ways.
happens.
Just let us open our own practices. Like, you don't want us under you? Well, we'll figure out a way.
Yeah, hygienists are doing it. Maine,
Right.
Colorado, there's some
Right.
New
amazing,
Mexico.
yeah,
Mhm. Yeah.
it's totally doable. And we're not out of the woods. Nevada
No.
was defeated, but Georgia is the next one up where they're discussing a similar pathway. And that one is actually considered a registered dental hygienist once they finish their coursework through with the dentist. So we have a big battle as hygienists to fight. Accredited programs need to be the requirement because we aren't just tooth scrapers, and on the job training and less than 3,000 hours is not acceptable. Like
Right.
you said, the base information that we got in that 4 years of getting an associate's degree was just the tip of the iceberg of what we learn. And then we develop those skills throughout our years and years of practice. So it's just, we're up for a battle.
Absolutely. I know. And I go back and think of the first office that I ever worked at as like an assistant, right? And if I was trained there as a hygienist, would not have been as good of a hygienist as I,
No.
yeah.
No.
So you started as an assistant too.
I did, yeah. So I went my senior year of high school, I went to dental assisting school. And then I worked as an assistant while I was in hygiene school. Yeah.
Awesome. Yeah, so we can relate. I too was graduated from the assisting program here in Wisconsin, and I always assisted. I love assisting. So throughout my entire career, I would hop chairside and be part of the team in that perspective.
Yeah, you definitely see a dental office in a new light after being an assistant.
I jumped in cold turkey. I had no idea if I was going to love dentistry or not. I was like, here it is.
You're like just to toss a coin and we're like,
It kind of was.
yeah.
But
Well.
here we are. I survived. I did good.
Oh,
I
yeah, there
grew
you
to love it. That's what I say. Like, I definitely was not passionate, but I am more passionate now than I ever
Wow,
have
I
been
love
about the field. So
Yeah.
you can grow the passion. You don't have to have it there if you don't love it when you're first out of school.
Oh my God. I've literally been like obsessed with teeth since I was 6 years old. So I don't know what I would do if I wasn't in dentistry.
That's so fun. I
funny.
don't want to say I could care less about teeth, but I am not one of the tooth fairy hygienists out there.
Oh, I'm not like dressing up or anything like that. Like but your kids
I
got
didn't ask.
you gotta watch out because I'm gonna be trying to like wiggle that out of your head.
So as young as 6, huh?
Oh.
That's awesome. I remember sitting back in the dental chair and looking in the goggles of the hygienist that was treating me and watching everything.
Oh gosh.
I was like,
I think I
probably looked
stared
like
at
a
mine
complete
too.
psycho because I was like, oh, this is great.
And then she's like, why is this girl looking in my eyes?
Yeah,
I
yeah,
gotta get-
totally now.
Yes,
But I was interested pretty young. Didn't really recognize it until
Right.
later. But
Yeah.
and then I used to sit in the bathroom sink and scrape my teeth with like
Yeah.
stuff, like needles and things, that I'd be like,
Yeah. Oh my God.
So
Didn't we all? Didn't we
Yeah.
all? Yeah, I know. And I think back and I'm like, oh, what was I doing to my enamel at that time? But yeah.
I'm gonna skip the next question because you already answered a couple of those for us. But so tell me a little bit about the coaching side of your business. I want to dig into that because I too have my own LLC and I'm doing coaching with
Yeah.
salivary testing, and I'm working with functional medicine doctors. How do you balance practice life and your vision for growth in that perspective and your clinical? I'm out of clinical now. I'm completely with bristle training, and then I am working with functional doctors and building my other LLC and that sort of thing. But tell me how you are working on your balance and growth for your company.
Yeah, I love that. And it's a balance because I love doing it, right? And I love helping people. So what my schedule looks like now is I work about 2 days full-time clinically. And again, I work with great providers and they give me flexible hours to where it works with my kids' schedules. And they're so great and supportive. And I just started my coaching business. So I have few clients. So I'm not too busy just yet, doing a lot of myofunctional therapy right now with the kids and stuff like that. But as for the functional health, so the way I run my business is I have my myofunctional therapy option that I have for people. And then I also have a functional oral health option people, which includes nutritional counseling, myofunctional therapy, salivary testing, other blood work if they need it, or HTMA, other mineral testing, any allergy or food sensitivity testing. I do that with them as well. And I just sit and deep dive with them, figure out what their needs are, and go over all their test results and figure out where they need to be nutrition wise. And a lot of people, what I find, are actually under eating. And when you undereat or you're not eating the right amount of macronutrients, it's actually going to really affect your hormones. And we hear that a lot. Hormone testing, Dutch test, this, that, and the other thing. But what it all comes down to is that if you're feeding your body the right way and we're absorbing the nutritions that, or absorbing the minerals and the nutrients that we need, our body is going to do the work for us, right? If we're feeding our body, it's going to do the work for us. It's going to detox the right things. It's going to give us the benefits that we really need. It's going to help our skin. It's going to help our gut. It's going to help all the things. Some of my patients, I do like gut testing. We'll do stool samples, make sure there's no like fungus or parasites, anything like that. But I do see a lot. Honestly, I get most of my information from the salivary testing that like I need for people to help them with their gut. And then we focus on like probiotics, oral microbiome. A lot of people, right, they're like, I just want to kill everything, get rid of it, but that's not what we want. We want that good bacteria. We want to be able to refuel it. We want it to help with our tissue, with our mucous membrane, keeping everything hydrated, things like that. So for my functional oral health program, there's a lot that goes into it. And like I mentioned before, salivary test is amazing for the Bristol test in particular for finding those nitric oxide levels, because people might think they're not a mouth breather, but the test state otherwise, that they really do need to make sure that they're nasal breathing. And that might be why they're feeling so tired. It might not be your hormones. It might be because you're not sleeping well. You never had a sleep study done and you don't wake up with a dry mouth, so you think you're sleeping just fine. There's a lot that goes into kind of functional oral health coaching, and that's just what it is. It's helping guide people, giving them the answers where they're at, and just finding out what exactly they need and what's going to be sustainable for them, because nothing is going to work if you can't come up with a sustainable plan for somebody. And again, a lot of like my myofunctional therapy clients that I work with, seeing them every 2 weeks, that's not sustainable for them. They're busy, their kids, their families. So seeing them once a month, once every 6 weeks is what works for them. So it's meeting those patients in the middle and seeing how you can help them best thrive and help have them have the oral health that they are pursuing.
Awesome. I'm going to follow up on a real quick question. Like,
Sure.
what sort of training did you do for the mineral testing and some of the other testing that you are doing? I know I talk to a lot of hygienists. I'm trying to encourage them to do something similar to what you and I are doing. And they're always looking for, okay, what kind of training do I need to do? Can you just walk us through a little bit of the platform of
Yeah.
what you have done for training and how you know how to read these tests and implement them?
So a lot of it honestly has to do with my background and my master's. So because I did a biomedical science major, I did a lot of lab work. Did a lot of
Oh, interesting.
lab testing, a lot of lab work, a lot of lab reading in that, specifically in like microbiology. So for me, that has helped. However, I do all of my tests that I run are through Rupa. Okay. And the way that Rupa Health works, for people that might not know about it, is that as a provider, even as a dental hygienist, I can sign up as a provider. Now, because I am a dental hygienist, I really only have access to salivary testing. And however, the nice thing about Rupa is that you can have a physician work with you and sign some scripts that you are recommending for your clients, right? So you have this array, depending on where your patient or a client is located, of testing that you can do. You can then pay additional fees for them to read the labs for you, or you can just get educated. Now, Rupa does offer some courses where you can get certified in those testing. I did one for HTMA through them, and then I also am registered for a Dutch test one that I'm going to be doing through them. So they do offer a lot of courses. Now, you don't necessarily become certified, but you have all the tools that you need to be able to review the lab work for these patients and then be able to give recommendations based off of their testing.
So a competency.
Exactly. Yeah.
Awesome.
So it's more of a continuing education course that you would be taking for those. Now, you can get certified in these courses. It's going to cost anywhere from maybe $900 to $2,000 to be able to get certified in this course. But my business mentor, when I had mentioned that to them, she's like, Stacy, you know how to do all of this. You don't need another certificate. You don't need any more letters behind your name. She's
Yeah.
like, you have enough. You spent enough. Like, just get the basic information that you need to be able to guide these people to help them. If you want down the road, yes, you can go get your certification, but it's at this point in your business, you know so much already, and here are the tools that you need, but this isn't necessarily going to help you. So yeah, I just take additional courses or credits in being able to read or get certified in this. And again, as a hygienist, a lot of us are like, no, if I want to use the laser, I got to get my laser certification. I have to do this, I have to do that. But all they really are too are continuing education courses with however many hours. What I would tell hygienists that are looking into expanding their practice is that don't necessarily focus on becoming licensed or becoming certified or becoming this. There's plenty of courses out there that can give you all the information that you need to help you be successful, whether it's nutrition, whether it's mineral testing and lab reading and all of those kinds of things. It's just a matter of finding how to access them to help benefit your patients.
Awesome. Are you looking at the bristle test through Rupa?
I try
lab
to.
one?
I like getting a copy of it,
Uh-huh.
but yes, I do.
So you're just doing that PDF?
Yeah.
Oh, we gotta talk.
Mhm.
Set up with an account because
Yeah.
you can see so much more.
I
Like,
know with
seeing
so a
pictures
lot,
and
I
things.
try like when patients, so I will get access because the patients will get access if they have their email on there.
Yep.
So I'll usually have them have them add me in the Bristol portal,
Okay.
add my email so then I can look at the comprehensive breakdown that you guys get. But yeah,
Okay. Perfect.
but the Rupa isn't as comprehensive as
Yeah,
what
no, try to convert anyone who's reading them off from Rupa just because the PDF is just not as effective. And the Bristol test, now we can customize the care plans and
Yeah.
that. So it's amazing what we can do that way. But I'm a nerd and love the raw results section.
Yeah. No, I
So,
do too. And because and honestly, that's how I found my sister's issue. Like
yeah.
looking at her thing, it's like gut health. Perfect. It was all in
Yeah.
the green. I was like, no, I need to look into
Yeah.
this. And so then, and it's when I found her periodontal pathogens is when I
Yeah.
found the fusobacterium. Yeah.
Yeah. Yeah. And there's a whole lot more like Enterbacter KCI groupings and it can impact that. So definitely we got to connect.
Yeah, I know. Yeah. No,
Yeah.
there was one that I didn't have access to the Bristol portal, and I was like, oh,
Yeah.
I want to see more. Yeah.
It makes every once in a while when someone sends me the PDF, I'm like,
Yeah.
I need the whole shebang. I'm lucky I'm able to, I can kind of share it to myself through being an employee.
can
So
hack.
yeah,
To benefit.
I hacked the system, but
Pretty
yeah,
much.
for sure.
All right, Stacy, this has been a phenomenal conversation. And if I'm being honest, I think for a lot of hygienists that just practice traditionally, clinically, this has probably been like a, what? Are you kidding me? Eye-opening conversation. And that's our goal, right, Heather? We're hoping to raise awareness of this ability to be able to practice next level and think out of the box of clinic, but still being able to use our skills to help patients. So I would love for you to be able to share your contact information, where hygienists can find you, or where we could even refer patients to if we're wanting to be able to give them more, and what kind of resources you would love to share.
Yeah, sure. So you can find me on Instagram, the hygienist mom. So it's the hygienist _ mom. And then you can also find me an email at Gmail. So my email is thehygienistmom@gmail.com. My website is also thehygienistmom.com, although it is quite up yet. But I'm also building a website, which is something I never thought I would be doing as a hygienist. So there we go.
All those digital skills
All
that we
the
decided
digital
we
skills
don't.
that we learn as we start our
Yes.
company.
Editing podcasts,
Yeah.
also not a skill I thought I'd ever have.
And and then you find out and you're like, wow, I actually enjoy this. This is actually really fun. But yeah.
Awesome.
Yeah.
Okay, I think we're trying to make our signature question. What does functional roots mean to you?
Oh, what functional roots means to me is really just finding out what your body needs, is making sure that you are where you need to be. And that might mean you need to be deep diving into a book by a lake with your dog next to you, right?
Yes.
With some hot tea, but really finding out what your body needs and what your body craves is what functional roots means to me.
I
Awesome.
love it. Thank you so much for being our first official guest on our podcast, Stacy. Phenomenal conversation. I wish you the best of luck. And we'll see you at Under One Roof, correct?
Yes.
Yeah.
I'll be celebrating my 40th birthday there. Yeah.
Noted. See if I
yeah.
can get somebody to call you out from the stage.
Oh my gosh. Please don't. Yeah.
Amazing.
I know. Well,
Yeah,
so good talking
definitely.
with you guys.